This segment of the news is brought to you by Finance of America. For all your mortgage needs, call Amy Childress or Shannon Keller at 702-372-6607.
Cardiovascular disease is one of the leading causes of death in the United States. Statins are a prescription medication that can help decrease the risk for cardiovascular disease. But just who is at risk? The U.S. Preventative Services Task Force, an independent group of medical professionals, continually reviews the latest information on a wide range of preventative services, including for cardiovascular disease. The task force has just issued a new recommendation statement on statin use for adults who are at risk for cardiovascular disease.
This health tip is brought to you by
Desert View Hospital and Mountain Valley Physicians Group. Don't put your health on hold. We have time for you. Call us to schedule your appointment. 775-751-7100.
In the United States, 1 in 3 adults will die from cardiovascular disease. Many doctors prescribe statins as a way to reduce cholesterol levels, lowering a patient's risk for a heart attack or stroke.
The risk factors for cardiovascular disease include high cholesterol, high blood pressure, smoking, diabetes, and your age.
Dr. Douglas Owens, an author of the U.S. Preventive Services Task Force recommendation, says the group recommends that some people, age 40 to 75, who have one or more of those risk factors, high cholesterol, high blood pressure, smoking or diabetes, and do not have a history of cardiovascular disease, and whose chance of having a heart attack or stroke over the next 10 years is 7.5% or higher, use a statin. Those whose risk is 10% or higher will benefit most. Although there are risks, Dr. Owens says the use of a statin, along with a healthy diet and exercise, can be a useful tool in the fight against cardiovascular disease.
The benefits of statins are a reduction in heart attacks, strokes, and death. The harms of statins we judge based on our very comprehensive review of the literature to be small. And in patients who are at elevated risk for cardiovascular disease, the benefits outweigh the harms.
Laura Berger, The JAMA Report.
The task force found the evidence for initiating statins for people over 75 years old to be insufficient. Police are on high alert and in at least one city mourning after 4 officers were shot Sunday in incidents around the country. Perhaps most startling to law enforcement is in at least 3 of the shootings, it appears the alleged perpetrators specifically targeted police officers. An officer in Sanibel, Florida was shot in a drive-by as he conducted a traffic stop. A Gladstone, Missouri officer was shot after a traffic stop that produced a foot chase and a shootout. A 20-year veteran of the St. Louis Police Department was wounded in what authorities characterize as an ambush, and a San Antonio police detective, Benjamin Marconi, was killed outside police headquarters in what appears to be another ambush. Marconi's death marked the 58th fatal shooting of an officer this year, well ahead of numbers for all of 2015, which was 41, but not as much as the 2011 total of 73. The Pets Are Worth Saving Extravaganza was held Saturday in the Calvada Eye.
Oh, the event went wonderful. Over half of our animals got adopted, which was a great success. All of our vendors came out, people supported us, and it was a great, great day.
So how many animals total?
I believe 7 dogs and 4 cats were adopted.
And so they still have some up for adoption right now, right?
Yes, ma'am, they sure do.
How can they find out more about that?
Contact Pets Are Worth Saving.
On the Facebook page, right?
Yes, Facebook is great. Our phone number is also on the Facebook page.
And they can also donate to Pets Are Worth Saving all the time.
Yes, definitely. We can always use donations, and every penny that comes in goes directly to the animals.
You had so many vendors here today.
I know. They came out just out of the woodwork. We are so grateful to the community support. Thank you so much.
It's been awesome here today, and lots of giveaways.
Yes, we had a lot of raffles. A lot of our local businesses donated raffle prizes and stuff. And even you came out and donated your time to be a DJ. We're so grateful to you.
And thanks so much for having us. When we return, we're going to tell you what's coming up for Thanksgiving.